each panelist to, wonderful. All right, so just to get the, because Bengals care, increasing mental health awareness and erasing stigma conversation going today, I'd like to ask each of our guest panelists to introduce themselves and share some information about their organization.
Recording is on.
So our first panelist today is Jillian Dombrowski. She's the co-occurring disorders supervisory counselor at TSI.
You are muted.
Sorry. Thank you. Thank you so much for asking me to be a panelist today. It's such an important topic, and I work right now at TSI. If you're not familiar with TSI, our mission is really to help people who are in recovery from substance use and mental illness integrate into the community and become empowered to advocate for themselves and build a new identity in that recovery lifestyle. So we offer residential rehabilitation services, housing services, case management services, and drug and alcohol treatment services for both men and women age 18 and up.
Wonderful. Thank you for being with us, Jillian.
Yep.
Next, I would like to introduce Jessica Pirro, who is the CEO of Crisis Services.
Hello, everyone. I'm so thrilled to be with you today for this really important conversation. Crisis Services is the 24-hour crisis center for Buffalo and Erie County. We have staff and our first responders available 24/7 to deal with all levels of crisis situations in our community. And it is really our mission to help restore safety, promote emotional strength, and reduce the impact of trauma. And that is done through the various levels of intervention, education, prevention work that we do, as well as the various community collaborations that we have in order to help people navigate through the various systems that could be supportive for them during a crisis situation. A couple areas of our specialty focuses are suicide prevention, emergency mental health. We are the designated rape crisis program for our community, and we also do domestic violence, family violence, elder abuse services, and also trauma response work with various types of trauma situations. So a very comprehensive crisis center for here in our community. But the most important piece is that we always have somebody available 24/7 to call and really help guide you through some next steps whenever you're faced with a challenging or crisis situation.
Great. Thanks, Jessica. Our third panelist is Missy Stolfi, Western New York Area Director for the American Foundation for Suicide Prevention.
Hi, everybody. So glad to be here with you today. Like Tanya said, I work with the American Foundation for Suicide Prevention, which is a national organization made up of chapters in all 50 states. And our mission is to save lives and to spread hope to those who have been impacted by suicide. Our work stems from our heritage as a research organization. We're the leading private funder of suicide prevention research. We engage in prevention education programs and resources, advocacy and public policy work at the state and federal levels. And we also work in loss and healing in terms of providing support to those who have been impacted by suicide. We also engage with the community through our various community fundraising events and activities such as our Out of the Darkness Walk, which takes place every fall in Buffalo. We're thrilled to be here. I have a background as well working with college students, so it's a particular population that's close to my heart, and we're really thrilled for the opportunity to work with Buffalo State College today.
Thank you so much. Okay, and then we would like to also introduce our moderators. I'll start with Dr. Jack Mack from the Buffalo State Counseling Center, and then Hannah, we will pass the baton to you, and then you will start us off with our first question. So Dr. Mack.
Hello, and thank you everybody for coming here, and I'm really excited to be able to virtually host everyone at Buffalo State too. So I'm Dr. Jack Mack. I'm the Assistant Clinical Manager of the Buffalo State College Counseling Center. I'm also the Clinical Training Director. I've been here here at Buffalo State for about 7 years, and I've been working with college students in various capacities for a little over a decade. And so I've definitely seen some trends that are happening, both in my personal clinical work and more on the administrative and data level, seeing in national surveys and national clinical data, the increase in the needs for mental health services even pre-pandemic. We were seeing, increases in stress levels, general mental health concerns. Like there's always every year a little under half students report in various surveys things like I've been so depressed in the last 12 months I've had difficulty functioning. So that's not necessarily saying, I have a diagnosis or I'm taking medication or I'm seeking treatment or anything like that, but just the experience and the difficulty functioning is really common. And then also seeing increasing levels of the specific mental health things like having a diagnosis, taking medication, having previous hospitalizations, having previous suicide attempts or traumatic experiences happening to them. So we're, in the context of this increasing need and this increasing sort of cultural need that we've had, we're also then dumping COVID and the pandemic and all of the changes and disruptions that have happened from that. So I'm really excited to hear from everybody about your experiences, especially in this last year, and in how we can best get involved in our community and in making a difference in people's lives. So I really appreciate you being here. Thank you.
Hi everyone, my name is Hannah Kellmeyer. I am currently a senior here at Buffalo State College, and I'm chair of the Student Civic Leadership Board here on campus. I'm going to start off with just a question aimed at anyone who would like to take this. I was wondering about stress. At what point does stress become distress? And what are some warning signs that you typically see?
I can get started. Oh, just a few. I think a good rule of thumb for paying attention to the difference between stress and distress is when stress is starting to really persist in somebody's life. It's more than just a bad day or a bad week. We all are going to deal with stress and stressful situations in our lives, right? But when we start to see some of these stressors really building up, they're not getting better, but getting worse and really starting to get in the way of our day-to-day functioning, whether it is school, work, relationships, sleep, diet. These are some things where we want to pay attention to those shifts. When you're starting to notice changes in mood or behavior, things that are atypical for what you know to be usual for that person in your life, whether it's you or someone you care about, that's when it's really worth a conversation to find out what's going on there, is when it's really sticking around a long time and you're having trouble shaking it. I think is really important for us to pay attention to. And that change can happen kind of subtly, especially if we're caught up in our own stuff, right? We may not notice someone else's stress for sure. And so I think paying attention to some of those changes over time is a really good rule of thumb.
Yeah, building on what Missy said, I know the context where I worked is a residential treatment facility. So we have 34 people living in apartment-style settings with our offices in the basement. So we get to see people 24/7. We're staffed 24/7. We see them in good times. We see them in distressed times. And the change can be pretty abrupt, like Missy said. In addition to looking at stuff that affects their daily living, we're also looking for things like change in appearance. Maybe they lost a lot of weight, gained a lot of weight. Maybe they're having days when they're just not showering. Sometimes we have residents who struggle with even self-care, basic hygiene, like getting up, brushing their teeth, taking a shower, because the stress makes them almost freeze, is how they describe it to us. They just don't know what to do, and they feel stuck in that level of distress. Another thing is we do rounds. So we walk around to the apartments to say hello to everyone, see who's home, see what they need. If we notice maybe they haven't been taking medications, or if the apartment's in disarray. We all have moments of messiness, right? But full stress is going to look a little bit different. For example, I was doing property review, walked around yesterday, and one young man had probably 5 bags worth of Coca-Cola cans in his bedroom, just thrown around. And I was like, hey, what's happening for you? Usually you're very neat. What's this about? What's going on? And he said, yeah, I just haven't really felt like doing much of anything. And, we explored that a little bit. And with his counselor, found out he'd been feeling depressed, hadn't been taking his medications. And it was all just from noticing his environmental cues. So sometimes I tune into those things too. If it's unusual from what the person to usually do, I like how Missy said, that's an opportunity to really sit down and just have a chat with them about, hey, I noticed such and such, anything I can help you with.
Yeah, and I'll just, both Missy and Jillian's feedback is really important in identifying those patterns of your behavior. And is it, I think when at crisis services, our day to day is dealing with individuals in stress and crisis, and we're really trying to understand what are some of the regular stressors in our lives, the things that seem predictable that we know might, cause a little stress, but it's a healthy experience. And then the shift to something that becomes destructive, that pattern of stress that starts to impact, as shared, patterns of behavior, interactions with others, inability to care for self, as well as just mood and attitude towards life and living and all that comes with that. So I think it's really important, to kind of look at stress and distress is that there's going to be stress in our lives, and those are things that we build coping and resilience towards. It's when those things start to compound and really become you can't manage them the way you could before, and it's starting to have destructive impacts on your mental health and your well-being. And when you start to see those patterns and those examples, it's important to take pause and see then who could help you kind of almost regulate yourself again, to see how we can pull out of that distress moment and figure out other coping or other ideas that can help to move away from that destructive space that can really have a mental and physical impact on an individual.
Thank you. I think that's a really great different perspectives. Having the different perspectives from your different populations and the different places you work is really interesting, because what we see here in a counseling center is going to be very different than in a residential environment. And what's in a residential environment is going to be very different than in a crisis services elevated, this is the lightning striking moment. There's kind of a different flavor of what we see, and what warning signs we might be looking for. But it sounds like a kind of overall theme that everyone was talking about was looking for a change, looking for some kind of change in your functioning, your change in your ability to engage with your life in a meaningful way. Some kind of, starting or stopping something that would normally be there, or an inability to access the things that you would normally do to cope with stress in a healthy way. Which, also would bring up, somebody mentioned earlier, substance use. That would be another warning sign that I would definitely notice in our population, I think in most populations, right? Is stopping medication, so stopping a positive substance use, or starting some kind of a relapse, or starting behaviors, self-destructive behaviors, in an attempt to self-regulate. But oftentimes that ends up sort of pushing it further off the path. So yeah, I really appreciate that. And so in all of our cases, our roles are to try and connect people who are either just having that normal stress, or who are in that more extreme, distress where they're having trouble functioning. We're trying to connect them to help and support and getting back into functioning. So what we wanted to talk about today also is stigma. And what are the barriers? What are the things that actually, if it was just as easy as, hey, here's the phone number, go call, and tomorrow your problems will feel better, we'd all be happily out of jobs. But what are the barriers that you see in your different populations to actually getting people to connect to either help or relinking with their healthy coping?
I could start. I think an important piece, just based off what we were talking about, that is a barrier, is just the energy to make that phone call, especially when you're in a depressive state or a moment that you just can't find the energy that sometimes you need to make that first call. So I think that can be a big barrier for individuals, is just getting the courage and the energy to make that contact to get the help. But with that being said, I think just how we view mental health in general has brought stigma in a lot of ways, from how we talk about individuals with mental illness, how the media, movies, social media, whatever it may be, portrays an individual with mental illness, as well as kind of compassion and patience with individuals who might be struggling. I think there's a combination of things that could keep somebody kind of at bay and think, I'm not going to say anything because I'm seeing how people are being talked about, or I see the frustration or the lack of patience with wanting to talk over and over again about what's going on for me. But I'm not going to reach out to my friend or my family member. So sometimes it's really a combination of maybe subtle, but maybe what people don't realize are just observable things that an individual sees in other people that really could keep them from reaching out and feeling that they can trust that the support in return is going to be compassionate and not judgmental. So we definitely see a wide range of stigma in the systems of care as well. If it's, different types of multidisciplinary systems, how they view individuals, how they approach an individual with a mental health condition, those are other things that have caused barriers for individuals as well. But I think it really comes down to how we talk about our mental health. And, I do think an outcome of COVID has brought mental health conversations forward in a very different way than we've seen, because it's become more of an experience for all than just a selected few, if you will. And so I think it has brought up a different level of a conversation around mental health. And I'm hopeful that that is then breaking down those barriers and starting to reduce some of those stigmas, that it becomes the norm to call for help around mental health, like it would be as if you had a cut or you broke your leg or whatever your physical issue might be. You're going to call the doctor. You're going to reach out for help for that. We need to bring some equal playing field, if you will, about mental health and physical health, and making sure that individuals feel that they're supported and can reach out when they're starting to have the onset of any type of symptoms or just struggling, and not being afraid to reach out and make that help. But with that being said, we also have a responsibility as friends, family, and just community members to understand we need to also reach in, and we can't always put all the burden on the individual struggling. How do we check in with people more? How do we, just ask if people are doing okay, that we know in our neighborhoods or our, workplaces? Sometimes that one question can make a huge difference for one person that is struggling. And I think that's, part of it too, is the many masks we wear to get through the day. A lot of times somebody you think is doing okay is not. And then so sometimes it's just those check-ins that can really shift, breaking down a barrier, getting somebody that help, and really making sure we're conscious of how we talk about mental health overall.
Yeah, I want to echo everything Jessica said about, especially to emphasize the importance of educating ourselves, just as regular community members, on risk factors and warning signs when it comes to mental health conditions. What are some, to keep an eye out for what some of those issues may be, and to educate ourselves on how to have that conversation with someone we're concerned about, because we all have a role we can play when it comes to changing our culture around mental health. And a lot of it is our own attitudes, because we may not realize some of what we give off out into the world may be picked up by somebody who is struggling, and they're looking at you. Are you somebody I can trust with this information about me? Are you someone I can rely on if I do, I want to open up about what I'm dealing with? And so you all have an opportunity to really help kind of set that tone. And I think a lot of it too is opening up as well about if you've had a hard time and what are some of the healthy ways that you've been able to cope. It creates more visibility for the topic as well, and can inspire others. One thing that's been really amazing, Jessica spoke about the way we depict mental health issues in pop culture and in media, there's been a lot of really cool examples too of how that's being done in a really healthy way. We're seeing more celebrities and athletes and notable figures speak out and build partnerships on how we can address mental health and substance use and other similar conditions, how we can start to address those in a really in a helpful, supportive, and authentic human way as well. So we have the opportunity to really kind of turn the tables on this topic because um, and we each have a chance to do that in our personal lives as well. You don't have to be a mental health practitioner to have a conversation with someone. It doesn't mean you're trying to be their therapist. There's a line there, of course, but you could be the one that breaks that initial ice. They may be really afraid to reach out for mental health support, right? They may be really afraid to go to a counseling center or reach out to a text line, right? They're not sure. It could just be they're really exhausted by what they're going through. So the thought even of making a phone call could just seem so hard to do, but they're maybe afraid, like, well, what happens next, right? And so to know they have someone by their side who cares about them and isn't judging them can mean the world to somebody. And this is where, even with COVID, we've had this opportunity, and it's been really amazing to see people check in with each other more regularly than they probably would have normally, because we're all conscious of the fact that it's been a hard year, right? Over a year now. And so, I've heard and seen people who are checking in with folks across the country who they really didn't talk that much day in and day out, right? Prior, because we were so busy running around all the time. But I think it's really shown we are capable of being there for each other in lots of different ways, even if we can't physically be together. So it shows what we can do. So let's continue that. Even as we start to open up more, let's keep those kind of vibes going where we are checking in, we're asking those questions of each other, but we're also offering up too some more honesty about what we're going through.
I definitely agree with everything that everyone has said so far. Missy made me think of something in our program. A lot of our residents see us just as, the counselor, not the human. And they don't think we can understand. They don't think that we know what they're going through. They always assume we've never done anything in our lives, used a substance or had anxiety or depression. And the pandemic did create a lot of stress. It also felt like for my team and for myself that it leveled some things in those differences because they understood that we were also experiencing the pandemic, and we would try to normalize the things that we were going through and use a little bit of healthy and safe self-disclosure with, I'm having a hard time with this too. I can't do the stuff I used to want to do either. Talk to me about how that affects your day. So just kind of normalizing a bit of that experience so that they knew we might have some understanding to help them reach out when they need to.
Thank you. On a same kind of related topic here, I know in my own experience, I know a few people that I talk to and they're kind of resistant to getting help, such as family and friends. And I didn't know if you guys had any ideas as to how would we support someone who is opposed to seeking mental health care, whether it be, my college student friends or family or, my coworkers, anyone even.
I should probably start. I feel like everyone else started first, so I think I'm up, right? So, Hannah, that's a really good question because I feel like a lot of people just have fear, like Missy said earlier, and Jessica, I think you said too. Not because of just making the phone call necessarily, but that next step. Okay, now do I have to change? That's pretty terrifying to think about if we have to change something, right? So I know for me, I've had a lot of family members, friends who have been opposed to it. They think they're going to have to tell a life story laying on a couch, right? All of these stereotypes they've seen in movies. And I usually try to just normalize for them the difficulty and how hard it is to put our defenses down and talk to someone that we don't know. Then I try to frame it as going in to talk to someone who doesn't know much about you and they have that outside perspective, and how whenever I've had a chance to get some outside perspectives, it's always helped me grow in my thinking processes and any behaviors I would try to change. So I always try to keep it kind of light, but also serious at the same time, a little bit of that balance, so that they know it is a serious matter. There are people who want to help, and that they can access that help when they're ready to do so. And I usually, will tell them, hey, if you ever need help doing that, please reach out to me. I can, give you some names or give you some agencies or give you some feedback, and just let them know that you can be that person that they can come to if they need it. Because hopefully making that connection might be enough to get someone in the door.
Yeah, I think one of the things I know we work hard at Crisis Service is really trying to demystify what that first phone call looks like, because it is scary. And it is, there's fear of like, what happens once I make that call? Right now I can control, even though it's an uncontrollable space, I can still control what's going on. So once we kind of bring others in, it's a little harder to, feel like, okay, this is going to help or is this going to hinder? But I think what's important to know for crisis hotlines in general, you can call a crisis line anonymously, just to talk about what's going on, kind of get support. We do a lot of supportive counseling off of our hotline. So, I think one of the other pieces too is to understand that even though we're crisis services, you don't have to be at a heightened crisis to make the phone call. And we really encourage people, if you ever think of making a phone call to a crisis hotline, for example, make the call. There's a reason why you're thinking that. And to know that the person on the other end is solely there for you to figure out what is going to be best for you in that moment. I will say, if there's a heightened crisis situation, and somebody is threatening suicide, for example, there's some different steps there that we definitely have to take to help provide care and safety for that individual. But kind of day to day, if you see that you're in a pattern and you'd like to try to understand more what's available, what resources exist, and then you can check out their websites, get to learn a little bit more about some of the providers, for example, and start to get comfortable with making that phone call. Those are things our counselors can walk through with you. We do a lot of coping planning with individuals on the hotline. We do safety planning, especially if there is thoughts of suicide or any type of self-harm or substance abuse over medication. Like, how do we manage that with the individual? Those are things that a counselor can do over the phone, and is a starting point to understand kind of what that looks like, and then it helps you to feel a little bit more comfortable with making the decision of connecting maybe to ongoing care or to counseling. I know it is a frightening step, but I think it's also a lot of education to understand what that looks like, because we all hear different stories that friends or family have experienced, but there's so much to each of those stories. So to learn what is best for you, and what step you're ready to take, we want people to be most informed at that moment. So when they are ready to make that step, then they know who to call, what's the best, organization that fits what I need, and also what are other resources that they can reach out to. I think also just with, there's, definitely the challenges with like social media when it comes to, balancing our mental health, but there's a lot of positives with a lot of apps and platforms that are very peer supportive and peer driven. So individuals who have lived experience, that could be a starting point for somebody to check out, talk with somebody who's experienced, some challenges in their lives and what they did, and hear those stories. There's some great opportunities online too that could offer that support as a starting point before maybe you then get into more ongoing counseling with a therapist.
Yeah, and I want to jump in and just say for the attendees or for people who are watching this later, we're going to include a lot of resources. Some of them are going into the chat, I can see as we're going, but we're going to include a lot of resources with this presentation. So if you are interested in learning more, which I hope you are, and how to start that conversation, or what kind of if I do start that conversation, what's my next step, or what can I point people towards? I think that that's a really great way that you, as a caring or concerned family member, friend, citizen, can help do a little bit of that legwork and make that first step a little less scary. Like Jessica said, is just knowing ahead of time, well, I already talked to somebody, and this is what you're going to experience when you call or when you go there. And I know that at the counseling center, we get that all the time. We get students, faculty, parents, anybody just calling us and saying, so what's your deal? What's going to happen if somebody calls? I'm not saying I'm going to call, but what's going to happen if someone else called? And usually it is about, I want to support somebody, but I don't know what to say. And when you consult with somebody and you talk with them a little bit, usually they have a lot to say. They have great ideas, and the sort of natural, caring connection that they have is wonderful. And then, a counselor or professional or crisis services can add in that extra piece of, and then here's the extra thing you should look for, or if they say this is what I would recommend doing. And then otherwise, that's what I would recommend doing. So I would also really encourage that as far as overcoming those barriers or overcoming that stigma is increase your network of support, talk with other people. If you aren't sure what to say, figure out how you as a team want to say it. Even just you and one other person, even you and just a counselor you've never talked to before can work on some strategies for how do you want to reach out to somebody or intervene with somebody. And so, like I said, we're gonna provide you with some of those resources as part of this today, so that you can do some further education if you're interested, or have those things ready so that you can pull them out. Another thing I'll say is a lot of times, and this is similar to what Jillian was saying earlier about humanizing and showing that counselors are people too and go through things too. I often I try to model for people that I don't have all the answers and there isn't some magical solution, but I'll just Google something right in front of people, or I'll say, okay, well, what do you think? Well, I think that too. Okay, well, now we're reaching some consensus, right? It's not this top down, you have to have a advanced degree to be able to figure these things out. We just need to be able to be willing to make that connection or start the conversation and start it going. And then once it's going, we can figure out what the next step will be. So, sorry, I didn't want to interrupt the flow, but I also wanted to get those things in there that will get you some more resources, and connecting to your supports is another great way to overcome people's fears or people's stigmas of, well, if you're worried about what your mom is going to say if you talk to a counselor, what if we talked to your mom together? Maybe I could help with that. Or here's what I said when I talked to my mom about it. And that might help somebody else figure out a piece of their story that could be useful.
If I could, I know in the chat, the resources were shared, and one of the last ones that was shared was the letstalkstigma.org website, which really touches on a variety of things that we're talking about today. And in addition to an amazing pledge that I would encourage everyone to check out, because it really forces you to think about how we talk about mental health and what role we can play, break down stigma, and increase access for people in need. It also has some really great video clips and stories from individuals with lived experience. So sometimes too, I think just hearing somebody else say the same things that you're thinking and feeling can really be very empowering and encouraging to see if this person was able to do it, let me see what I can do for myself. So really, there's a lot of great resources like that, I think, that can share different experiences that you might see yourself in, and that might help give you some of that encouragement to be ready, when you're ready to make the call for help and services or treatment.
Yeah, I can't say enough about how much I appreciate all of the organizations, but the one that I've worked with most directly and most frequently is crisis services, as far as being really, in the trenches and the front line of making a difference in people's lives. But one of the things that we were talking about the group of us were talking about before, was the idea of working on stigma and increasing people's awareness of and support for mental health isn't the job of counselors or politicians or hospital administrators. It's really everybody's job, and that's something that I try and reinforce all the time with students and in my personal life too. Is that I'm a great resource. We're all great resources, but we're not the only resources. Your story, whoever's seeing this or listening to this, your story is going to be really helpful, and that's going to be really critical for someone. And as many times as I've heard, I was stressed or suicidal or considering, stopping my medications or considering picking up a bottle again or, whatever. And then I talked to my counselor and they figured out a way for me to cope better and we helped it out. Probably more often, they'll say, I got up to that point where I wasn't sure what to do, and then I got a phone call from a friend, or then my neighbor stopped by, or then I had to pick up my kid from school, or then I had to go to work, or, the sort of normal community healthy connections that we have are really so critical in these efforts. And not thinking that it has to be some special thing that, again, a psychologist or a psychiatrist has to hold the reins of helping people and making change.
Thank you all. I just had, and again, if anyone else has any other questions, feel free to open up. I was just wondering with COVID, since it's so impactful this past year, so I've just wondered, how has it impacted like each of your organizations and agencies? What are some differences that have happened? Has it affected the population at all? I just wondered if you had any insight on that.
I can speak to that if you want me to start. Oh, wow. Yeah, so the impact, we in our role as a crisis center, we're obviously monitoring the impact into the community and what we need to do to continue to pivot and address response services. And throughout COVID, our team never stopped doing that service. We really had to adapt how we were going to do that safely. When we were going out in the community to, if somebody was in a high crisis, to do a mental health assessment, that's in person. And we from day one never stopped doing that. But it was a huge shift for our team to now have to be completely, PPE'd, if you will, to be able to do an intervention with someone. And that is such a different feel than when you have their face and their nonverbals, and all of a sudden everyone's masked and you have shields over your face and all this other stuff. So it really, our team struggled at the beginning. They knew it was for safety, but it really, that connection piece was really disrupted because of the need to have that barrier for safety. But wow, here we are a year plus later, and we're tired. I'll be honest. I think everybody is tired in its own right, but from an emergency service lens, it's just you're always trying to provide that feeling of hope and in some recovery from an experience. And COVID has brought us a time of hoping that recovery is coming. And I think we're there. We're seeing it now. I feel there's a very different vibe and feel even in our own teams as the vaccines have been distributed and just more and more things starting to open up and be available. It really has helped because we rely on that for our own self-care. And when that was shut down, our teams had to really shift of figure out how do they release their day-to-day stress with this work when they can't go to the gym or they can't do this or they can't do that. So we had a lot of, obviously in our normal times, if you will, self-care and conversations with our teams are happening regularly to check in because of vicarious trauma and just the constant exposure to crisis and traumatic situations. So that's part of our operations and our culture in our own right. But then having this experience where, as a leader, I can't tell you when this is going to end. I can't tell you when this is going to change. Is hard. It was, we really felt those impacts. And And definitely peaks and valleys as we, went through, but really had to think of self-care in a different way for us as emergency providers, because the services can't stop, nor would they stop. We just had to really shift things differently. And some people could, jump in and do that well, and others had to take, I said kind of like tag out, kind of like if you're playing basketball, you gotta, stop the team and tag in and tag out or substitute. We had to keep doing that throughout the year to give people breaks more, and really think a little differently about what they could give in this very stressful experience that COVID brought. So from our own experience as the provider, we learned a lot about ourselves. We learned a lot about, the creativity we could bring in those spaces when we had the energy to do so. And really also just honoring the fact that some days it's going to be really hard, and we have to really look towards each other to say who's got the more energy today to manage this or deal with this, and how do we really support each other through that. It was, from my lens as the CEO of this organization, we deal with crisis response and crisis management, but this was very different. And it was so long-term and continues to be long-term, which impacts your recovery and your resilience differently. We thrive on adrenaline, but our adrenaline, got depleted, and we had to keep filling it back up and find creative ways to do that, to be able to keep up with the demand that we knew was going to be faced to our mission. So we learned a lot. We've had, like I said, it's been a bit of a roller coaster. We've had good weeks, everybody's going, and then there's the weeks that we're all hitting the wall and we have to rethink how we're managing the week and the day. But the mission keeps us present and focused. And we've been very proud that we've been able to still fulfill that during this pandemic specifically. But I always, kept saying, thinking back to our mothers and fathers who founded our organization, how they would manage during pandemic, I was kind of trying to do the best I could with the information we had in front of us. And we were able to plug through and continue to plug through. And I'm really proud that we didn't have to stop services, that our hotline never had a impact with staffing, that we couldn't meet the demand. Not to say we can't use more staffing, and I'll put a little recruitment note out there. We are hiring if you're interested. We need that support as well. But I will say we learned a lot, and but I know from other providers too, in emergency type care, it's trying to keep filling the cup, if you will. The energy goes quick because there's just so much going on with this pandemic. But the teams really did a great job for supporting each other and our community too. The outpouring encouragement, and we had coffee shops send us coffee or food or things like that. Like that really makes a huge difference. Like you feel that appreciation, and that always gives another boost of energy that's needed at this time.
Yeah, we're part of those circles that need to be checked in on too, right? And that's a big theme that's coming out of everyone saying is those personal connections really help.
I would say one thing that was really interesting for us, AFSP, we are not a direct service organization, so we do not provide counseling or crisis, response. But one thing that was really interesting was dealing with some of the rhetoric out in the community, locally and nationally, around the pandemic and mental health. There was a lot of people who were just kind of like talking, including people with very, influential big platforms, about how, well, if we're locking down, therefore everyone's going to want to kill themselves, and speaking in these really really broad stroke, terms, and, and a lot of this whole discussion about when do we reopen because of this and this. And so there's been, the topic of mental health and suicide prevention, has been really, swept up in a lot of this, like, how should we do this? When do we reopen? Who stays home? Who goes back, right? All of that. And so I think too is really making sure that as best we can is to get accurate information and insight out there, including, things that are evidence and data informed. and making sure that we're not just wildly swinging a pendulum in terms of, our national conversation, and that, trying to find what is that more kind of middle ground where we're able to say, yes, there are going to be some increased challenges when it comes to our mental health and the impact of COVID. But we also see where there are opportunities. We're hearing, stories of people who do telehealth visits are having much more success as far as people showing up for their appointments, right, more regularly, things like that. We're hearing, other stories of people being reaching out for the first time ever for support, and seeing statistics around where suicide rates are going down in 2020, and so it's not all just like something we can just paint with a broad stroke. And as we mentioned earlier, the way we talk about mental health, the way we talk about suicide specifically, it matters. And so the language we use, the wording and terminology we use, it's really important that we don't make it a self-fulfilling prophecy that, like, okay, well, everyone's going to, because we're going through this national crisis, that everyone is going to get depressed and everyone's going to overdose and everyone's going to do this, this, and this. Certainly we see some increased risks and challenges, and the way we do business obviously changed for no matter what industry you're in. It had an impact, right? In some ways, those services maybe were able to happen easier or just maybe more streamlined. And in others too, we had opportunity because people were actually paying more attention to the topic. Like Jessica said, is that there was that shift. And so that's where there's opportunity to get support for people, because folks who normally just didn't even give a second thought to mental health this year were really starting to educate themselves or reach out to others. And we also saw that too a lot in the workplace settings. That was really pretty remarkable too, is to see businesses, corporations, large and small, how they were taking steps to be there to support and create some mechanisms for support for their employees and their employees' families. So I think that's another way we're seeing actually some lasting, I think hopefully positive impact as well. So I think for us, that was one thing that was really interesting, is even just personally, I would have people Facebook message me just because they know the work I do. And a lot of people sending me doom and gloom articles. For some reason, they just thought that I wanted to see all these like horrible articles and headlines as if I didn't know what was kind of going on in the world, right? And they're like, what do you think about that? What's going to happen? And I'm like, none of us know what's going to happen. That's part of the issue with COVID, right? But it's about, okay, since we don't know what is going to happen, let's focus on what we can do, what we can address and control together, right? And so I think that's a lot of just the language and rhetoric was just really, I think, a particular interesting challenge for sure.
I know at Transitional Services, like Jessica was saying, our work never stopped from day one. We're staffed 24/7. The residents live with us 24/7. At our specific unit, everything was shut down and they were not able to have visitors. So because they live in apartment style settings, family can visit, friends can visit, all of that stuff that we take for granted. And that was really difficult for them. They already were feeling isolated as part of their recovery processes. And it was difficult. Self-help meetings shut down. Everything that we planned for them to do to stay sober, to stay healthy with their mental health, all of these connections we encouraged them to establish were not there. And it was challenging, it was terrifying. The residents really did not know what to do, and it felt for a moment like we were all helpless because we didn't know how to help them. Everything we helped them plan for was no longer available. So while we're doing through our own experience of the pandemic, we're also, considering them and their issues. On the flip side, it really made our population very resilient. I know there were a lot of overdoses, a lot of overdose deaths. They increased a lot of depression and anxiety reported. But we had residents who didn't even know what Zoom was, starting to hold Zoom peer groups just with the people in their apartment buildings. We had a group of ladies who used to sit together to crochet, start a Zoom group. And they couldn't leave their apartments, but they could be on the phone with each other, Zooming and crocheting together. So I was really impressed about how resilient people got, and a lot of our residents are over age 50, and they would say, I barely know what a cell phone is. I can't do a telehealth appointment. And now they're all doing telehealth, and they're making it to all of their appointments. And I had one man say to me, I've never done therapy this consistently my entire life, and I'm 62 years old. But telehealth opened up that opportunity for him to keep an appointment because he didn't have to leave his house. So I feel like it really helped us build on strengths that maybe our residents didn't know we had, or even in ourselves, we had to get creative. I heard someone say that earlier. And I think it made us stronger. It's still hard. It still will be hard probably for who knows how long. But I'm hoping some of those impacts will be lasting. You know, we were able to reframe it with the people we directly work with to say, look at how strong you were. You made it through this pandemic and you didn't relapse. So many people are relapsing. Well, you made it through this pandemic and you relapsed, but you pulled it back together and now you're sober again. You know, it just, whatever strengths they had to get through it, we've really been trying to help them build and work with.
Well, and I think that, this year, as everyone has said, has really laid bare, excuse me, a lot of what either people took for granted or they thought was impossible. Thinking, well, I could, because I heard the same thing from colleagues and even from students that, I've never done this before, so that's impossible until you have to. And then when we have to, suddenly, sometimes it doesn't work and you got to get creative and you got to change, but sometimes it does work. And then you've got these other opportunities that we then get to keep after COVID is over, which I'm really hopeful that, people talk a lot about going back to normal. I can't wait for things to get back to normal. But I think that one of the opportunities of this last year is that we don't have to go back to the way things were in 2018. We can go forward to the way things can look in 2022 or something like that. And I think another piece of that we had talked about a little bit before this meeting too is the increased awareness of and social disruption around racism, systemic racism, and specific incidents that are happening, either in our personal communities. We had some pretty dramatic things happen here in the Buffalo, Western New York area, and then also the kind of ongoing stress and trauma of engaging with that over and over again. Obviously, that's nothing new. That's been part of everybody's lives for forever. But I think that we have had the increased conversation and awareness about it. And some of those similar trends of a lot of doom and gloom and a lot of really realistic, terrible awakening, but then also some opportunities and also some places for hope, or places for creativity and making more community. So similar to the question that Hannah asked, I'm wondering if you all could speak a little bit either from your organization perspective or your client or patient or customer perspective. How has this last year changed how things operate for you in terms of engaging with communities around social justice, social inequities, racism, that kind of thing?
I can get started with that too. And, thank you, Dr. Mack, for bringing that up because absolutely while we've seen, some really kind of positive impact, of course, of people reaching out and asking for help and all that is we know that there are certain members of our community and certain aspects of our community in Western New York who are seeing increased rates of suicide attempts and deaths, and especially looking at our communities of color and Black youth in particular across the country. This is really becoming much more of a public health crisis. And so making sure that when we talk about things like barriers to care, a lot of that has to do with having, affirmative mental health care and having resources that reflect the community that they serve. And so, we see this with other high-risk groups like LGBTQ. We know that, right now, unfortunately, there's a lot that's in the media across the country around transgender and non-binary, mostly kids, but also adults as well. And so definitely things that can be really harmful to the, healthcare for people in the queer community. And so, definitely looking at certain groups within our communities, are they getting the support they need as well? And recognizing that it might not be a one-size-fits-all approach. making sure that we're supporting people to be able to enter those fields as well of mental health care. I think that's another piece too, is making sure that folks who are going into mental health positions, social work, all of these kind of helping professions, that they're getting the support and resources they need too. Like Jessica was saying, is how taxed, how taxing it certainly has been, for the staff in crisis services alone, right? And we're seeing that across the country. So making sure we're focusing on, are we providing an opportunity for a next generation of folks to come in, and recruiting a diverse workforce and making sure everybody's trained and they have that cultural competency as well, so that they can best meet the needs of changing communities around the country. And then, of course, too, to make sure that we're making the policy change that needs to happen as well. And so, especially around, support for crisis response, right, is that to make sure that organizations like crisis services have what they need, right? And so I think that's where we're seeing a lot more of those conversations happen at the state and federal levels as well around mental health supports and making sure that change is happening, that we're not cutting those programs and cutting programs like TSI, right? But that we're making sure that we're getting that parity, if not more, because mental health and physical health need to have that same level of importance in terms of their support, whoever is funding it, right? And whoever has that oversight for, what we do, what we don't do. So those are all areas where especially this bigger attention and like you said, Dr. Mack, is definitely, none of these are new issues, but we have a stronger spotlight on it now. So it's now what about, okay, well, I'm aware, that's great. What are we doing to take steps to make those changes, though, to increase capacity for all communities, access and capacity to quality care. So those are definitely some things, we're seeing and, we're addressing as an organization as well, as how do we better meet the needs of a diverse community and a diverse constituency. So, and we're not done yet. That's the big thing too, to remember that none of us are ever going to be done doing that work.
Jessica, you're muted.
Thank you. Sorry. I had my thing hovering. I thought I clicked off. So yeah, I'm trying to think kind of, I feel like I have a couple different lenses that I could offer, because from the service side, especially this, last summer in Buffalo when we had a lot of protests going on and a lot with law enforcement going on, our teams work in the field, out in the community 24/7. And we also do work closely with law enforcement on various cases, because, if somebody does have to go to the hospital, for example, law enforcement may be involved in that transport to the hospital. But also just the ability to be out in the community during this time of social unrest. There was a lot that the staff had to navigate in addition to the pandemic, is navigating safety around getting into neighborhoods that we needed to respond to that might be part of the protest. So we had a lot that first couple weeks there of navigating how to assure staff could get out to visit safely, because and also just understanding what was going on when there was curfews and all these other things that became another thing we had to evaluate and how to address that from a service lens. So we had that experience that we worked through, and the staff really were trying to understand how to work through all of that to get to the people in need. But then we had some challenges because of what was going on in our own community. And as well as getting into, to homes, especially our clients of color, especially if law enforcement has to be involved. So we were also navigating those assessments and understanding when to pull law enforcement in, how to have those conversations even differently with our clients that maybe we didn't have before. We really had to look at racial trauma, and we had to really evaluate these steps during that time and now carrying forward. And it really has thrusted us into a space of true reevaluation of crisis care when it comes to racial trauma and how we evaluate things a little differently. The steps when we decide on emergency service is involved, when it needs to be involved. we really took some pause to relook at that and work towards how to do that better, how to honor our communities of color better in a crisis response moment, which was something that our teams really talked a lot about and continue to evaluate. We took advantage of an opportunity we applied for a process that's put on through the National Behavioral Health Council, and they have these communities of practice that you go through, and it's called Trauma-Informed Resilience-Oriented Care, and it's really walking you through your whole process of care and how we not only look at trauma, but how we look at racial trauma. So we actually, this opportunity did present itself. We were chosen to participate in that, and that really has helped us internally go through a very thoughtful and intensive process to evaluate everything from hiring to staff support to just language to intake procedures to everything in between for our organization, and we're really excited about that opportunity to help guide us through that, and I think it will help us to start make those important evaluations, and also what we need to do different to be accessible, especially to our communities of color, and build the trust that they may not have with us as an organization right now. So those are things that really quickly evolved. We have a lot of very energetic, very advocacy focused staff as well. So really like talking about how to use that energy for not only crisis services mission, but other things they personally can do on their own to care for this community. Were a lot of conversations we had with our teams, throughout last year, and continue to do that. I know in partnership with Missy, we oversee the Suicide Prevention Coalition for Erie County, and Missy's one of our guiders and members of that. And that group had a very, especially after the murder of George Floyd, sat down, virtually through our meeting and said, where's everyone at? Like, let's check in. What do we need to be doing differently? What should we be talking about differently? And created a separate committee to really start to target training more, leaders of color in suicide prevention training, knowing what we were seeing with the numbers and continue to see with the numbers. What do we have to do differently? So there was moments, through the experience that, have shifted and have brought some great initiatives and some great needed change. But as Missy said, there's so much to be done, and but it's starting that. And I'm, really looking at it from the crisis care lens. There's a lot there that we have to think about. It's very fast paced in intervening, but we have to be even more thoughtful about how to do that for our communities of color.
I have a thought, but I don't want to step on you, Jillian, if you were about to jump in.
No, go ahead.
Okay. I just wanted to again, give another plug for, if you are worried about this, if you're considering, if you have questions about this, to make sure that you're talking to somebody about it. And if there is an opportunity that has come out of all of the trauma and difficulty surrounding these issues, these social justice issues, it's been that I think things are on the table now in a way that maybe was considered, I don't know, impolite or too scary or too something to talk about before. And I'm just thinking back a few months ago when one of the times this semester that I've had to call crisis services and talk about a potential crisis and potential transport, being able to say to the person that I was talking to, yeah, and this person that I'm talking to is also, she's a Black woman, and she specifically mentioned, X, Y, or Z, and she's really concerned about what's going to happen in this phone call that I'm making right now. Can you tell us a little bit about what you expect or what might happen, and what we can do to help this person feel safe? And, maybe a year or 2 years ago, that question certainly would have been able to be answered effectively. But I think now the sort of cultural conversation makes that happen a lot faster, of saying like, yes, of course they're concerned about that and they have every right to be. And also here's our strategy, and here's what we can, here's the safety, and here's the, things that we can answer those questions, that kind of thing. So yeah, I just really encourage, again, if people are concerned about it, talking with each other and with your community, whether that means talking to a leader or a mental health professional or a professor or a parent or something like that, or just talking to peers, friends, family, that sort of thing, that's allowed to be part of the conversation too. What are the barriers? What are the things that, if I give you this, what's going to help you call? What's going to help you not call? Or what's going to make you not want to call? And if you could talk about those things earlier on, instead of waiting for it to not work and then say, okay, well, why didn't it work? Because that sometimes turns into, well, what's wrong with me? They gave me help and I didn't take it. Versus being able to say it's normal to feel stressed and scared and worried about all of these things. They're out there and they're legitimate. And so if we can talk about that right from the beginning, it makes it a little easier to get through the door, or to pick up the phone, or to walk across the hall to visit your neighbor and knock on the door and just say, hey, how are you holding up in there? I want to sort of use that as a way to transition to another thing, which everybody's been mentioning, these different action steps that you could take. Some of them are really personal or interpersonal, like checking in on each other, checking in on your coworkers or your friends or family. And some of them are more systemic level, like supporting policy or funding, or people who are going to support policy and funding. But can you give us a sense of, again, from your perspective, how do we address that general social stigma? And what are the action steps that the people who are attending now or who are listening or watching this later can take if they want to get involved, when they are feeling fired up and wanting to say, this is my perspective, this is my story, and I want it to be heard, and I want to do something with it. What are the steps that you would recommend they take?
Yeah, I would say is telling your story is a really big piece of that, is a step. I think definitely educating yourself. I think a lot of these links that Tanya's sharing in the chat here are great points to start, and find I guess what aspect of mental health speaks the most to you. So whether it is about equity and access to care, whether it is, reducing stigma, whether it is about, wanting to make systemic changes, whether it is about, wanting to maybe volunteer as, a crisis text line, counselor, whatever it might be. There's a lot of opportunities out there for organizations, local and national, to lend a hand. I think start clicking around some of these links to explore what those opportunities might be. And to recognize everyone has a role they can play and should play when it comes to really shifting our culture when it comes to mental health, and especially around reducing stigma. I think visibility makes a big difference. The more we see and hear, these conversations and examples of mental health being really featured positively, that all continues to help, just reiterate the importance of it, but also helps us to undo and unlearn some of the things maybe we've, these messages we've heard over time. It's really cool because, a generation ago, we definitely weren't hearing, programs like this put on, right, on campuses, or at least as regularly. So the fact that these are happening now is really amazing. That the counseling center is somewhere that's doing outreach versus, okay, it's just this little pocket of campus and you're embarrassed to go over there, right? Those are some things we're starting to see already shift. So people are ready to see change happen, but they need something tangible to do with it. So I encourage anyone who's watching this, today or later on Facebook, is to take a look at some of those links and get to know those organizations and their missions and their programs, and think about, okay, where do I see myself? And so you don't need to change the entire world to still make an impact on your corner of it. Because we recognize these are some really big, huge stuff we're talking about, right? But you can still absolutely and should play a role locally. So, I know to speak, for my fellow panelists, any of us would be happy to connect with you or someone in our department or our organizations, with anyone who's watching this, who's interested in getting more involved. And especially if you're looking for internship opportunities and the like, either with our organizations or with some of the folks that we partner with in the community, we'd be happy to get you connected.
I can share, I think at Crisis Services, a couple opportunities, like immediate opportunities, is we do utilize volunteers for our hotline services. Another part of our organization is our advocate department, which is the rape crisis, sexual assault, domestic violence arm of the agency. And we also use volunteers to help with hospital response. So if there is an individual who experiences domestic violence or a rape or sexual assault incident and then goes to the emergency department after for treatment, our team is called out to do immediate crisis intervention support, safety planning, advocacy, making the numerous decisions they have to make in that moment of trauma, and guide them, to what are those next steps and what are some opportunities for service and support going forward. So we do have two, pretty intensive but important opportunities through volunteering. Those also can be, used as internship opportunities as well. And we provide, a very intensive training as part of that to prepare people for that work. But that's definitely not the normal volunteer experience, but really an opportunity to really have an impact in the moment with somebody in crisis, and being comfortable to be present and helping people in those moments. So from a volunteer lens, we definitely need volunteers and encourage, that consideration to give back. There's many, advocacy groups, as Missy shared. I'll just do a plug again, with the letstalkstigma.org website. There's an anti-stigma coalition that created that campaign. And part of that is the pledge. And, it might seem like a simple thing, and it should take less than 2 minutes to read it and put your email in and make a check there to say, yes, I'm going to pledge to do this. But those statements that are provided to you to really think about and start to embody in your day-to-day really have a huge impact. And a big part of the first part of the pledge is really paying attention to our language when we talk about mental health. How often are we saying crazy or calling people crazy or using words that are very, stigmatizing around individuals who are struggling. You would be surprised how often we use that language. And even for us as providers, all of our staff take this pledge and we talk about it regularly because sometimes you don't realize the language that's just so part of your routine. So it's little things like that can make a huge difference, because we know in our community, based on the local statistics, we have about 1 in 5 people are dealing with some sort of a mental health condition in some capacity. So when we look at that in a room of people and we start using very stigmatizing language, we're going to shut those people down that we know are there. So the little things that could make it more comforting, more compassionate, non-judgmental, is really about the societal shift to make it more the norm to seek help and see that as a strength than a weakness. So those are, a couple things too that, people can consider. But there are a lot of different volunteer opportunities, and just a lot of advocacy work. Even the work that AFSP does every day is, the different advocacy things you can do to reach out to our elected officials around certain policies or initiatives to, advocate for that or make your voices heard. There's some great opportunities there. There's some great organizations locally, like the Mental Health Advocates of Western New York. They have some great peer groups. They do some, advocacy work there as well. So just, there are some great connections to be made. And, and again, it can be as simple as taking a pledge and just being thoughtful of your day-to-day, to the other extreme of, you want to get into this work and you want to give back because of your own experience, and, consider volunteering, with an organization like Crisis Services.
And building on that, TSI also welcomes volunteers. We host different peer support groups where people come in just to share their stories of recovery. And that's open really to anyone who may want to do that. I always suggest to like trying to take a mental health first aid type of training or something similar to that, just to have some increased knowledge about mental health and how to understand when people might be talking to you about their symptoms, that this might be just more than stress. It might be something a little bit more that you're not diagnosing, but maybe someday will be diagnosed. So just to help people understand and normalize that. Another piece of TSI's mission is to prevent homelessness in mentally ill populations, which is a significant problem, especially in Western New York. So educating yourself about homelessness and mental illness and why that is, why those two things go together so much, and what we can do to ease the homeless problem in Western New York. You know, not just with mental illness, but in general. That's another thing that would be helpful too. And the other thing that people aren't always so happy about having to do is paying attention to politics, pay attention to the budgets, the state budget, who's getting funding. I hate that it always has to come down to money, but unfortunately it does, and especially in mental health housing and residential rehabilitation. If there's no funding, the people in my program have nowhere to live, and they're out on the street homeless. So we do a lot of advocacy. There is something called the Bring It Home campaign, which is out there. You can look it up in any search engine. It allows you to send letters to your elected officials to show your support of mental health funding, whether it's treatment, prevention, other types of advocacy. If there's someone who wants to have your voice heard and you want to take it to Albany, that's a fantastic way to do it. If you're looking at, being an advocate on that level and maybe not doing direct service work with people in the field, that's another thing that we always need. We need so much support from the community, not just during the pandemic, not just right after, but in the long term. We're still going to need that support.
And I think
Yeah.
just as a reminder too, is that change does take time, but it also can happen really quickly. And so I think patience and persistence is really important whenever you're engaging in a kind of a new, volunteer endeavor. Making sure you're educating yourself on kind of that organization, the community you're serving, what their needs are, and talk to as many people as you can when you are with that organization, and just really soak up as much of that knowledge and experience as you're able to. It recognizes that certain things, especially around policy change, can happen. It might take a really long time, especially at the New York State level, but things also can happen super, super quick if there's enough energy behind it. And we're seeing that happen with a lot of things that are, is that some of these bills will get introduced and then they go through really rapidly, and others things will languish for a while. So I think that, 2020 and now early 2021 shows that anything is possible, right? And so with that, go through and think about with you as an individual, okay, if anything's possible, then why can't I be a part of that, right? And so, so I just want to just encourage each of you, especially any students who are out there, and you're thinking, okay, well, I'm just a student, what could I do? And we need that next generation of professionals, no matter what field you're in. Mental health impacts no matter what career path you're going to be in. Mental health is part of it because it's part of each of us every day. And so, is to really think about how am I going to advance these issues and be an for change moving forward, no matter what my path is. And so, so you are really beautifully suited to be able to help make that change, and also kind of really take that baton from, those who have come before you in terms of this work. So we're relying on you to really make that impact and that change, and we're excited to see what you're going to bring to the table as far as the mental health space. So, so we're just really excited to see kind of what will come next in terms of really this mental health revolution that's happening.
I was going to say that, I think one of the things that we talked about was changing from your own personal perspective, the language, being aware of the language you use, being aware of the processes that you go through in your day or in your job or in your social groups, in your, church groups, your organizations, whatever it is, that is a place where you can make a huge difference, even though, it seems like it always has to come top down, and those things are very important, as Jillian said, supporting politically and financially supporting the things that support things like affordable housing and meaningful vocational services and helping people with their minimum wage, helping people with health care. Those are the things that end up having a huge impact on people living meaningful lives, reducing stress, reducing trauma, and reducing these crises. That may take a generation to build, but once it's there, we've got that resource forever. So hopefully we can all build towards that. And I really hope that everyone who's participating today can find something at least that they can say, that's the piece that I'm going to hook onto. This has been a very long and interesting and fruitful and multi-dimensional conversation. And I hope that anyone who's listening now or who's watching it later, even if maybe you can't do everything that we've talked about in this whole time, I hope that you really find something that is meaningful to you and really grab hold of that and say, this is the thing that I'm going to do. Because if everyone does that, if everyone does one piece of it, then everything moves forward. And just as Misty said, when you've got that groundswell of support and that energy behind it, even if it's coming from a million different directions, it all moves in the same forward motion.
We have some questions from the chat. We want to stop recording and do some Q&A for our last few minutes here.
Sure.
Right.